as well as the proximal, radial, and ulna. There's a lot of points in here that you notice you won't have to palpate for the final exam, so it's not indicated with the dots. Also, mostly it's because some of these are very hard to palpate and are deep to too many, much soft tissue. So I'd like to direct your attention to here and here. So if we click on the, let's see here, the trochlea of the humerus, we know that the medial part here is the medial epicondyle. So I want you all to find the medial, you're finding it, that bony thing, bony prominence on the medial side of your elbow. That's right here. That's the medial epicondyle. And that's part of the humerus. The lateral, find one on the lateral side. It's not as prominent, but it's the exact same spot. So we have here medial epicondyle, down, lateral epicondyle, medial epicondyle, she bends her elbow, it's easy to see, lateral epicondyle. We have the ridges, so just superior to the medial epicondyle is the medial supracondylar ridge. So it's medial supracondylar ridge, and then lateral supracondylar ridge. We have the trochlea of the humerus, which is the articulating surface within that joint. We have the coronoid fossa, just superior to that. We have the capitulum, right there. And so those would be ones that you'd have to not palpate, but label and find, but not palpate. So we have the medial epicondyle, lateral epicondyle. We have the ridges, just superior on each side. For the ulna, we have the olecranon process. So that's our funny bone, olecranon process. And the olecranon fossa is on the posterior part of the humerus. It's the place that the olecranon process will articulate with. And I'll show you, if we go back to the, or go to the ulna, and we, looking at landmarks, let's look at the olecranon, right there. We have the radial notch, which is where the radius will articulate. The head, which is on the other side of the ulna. The ulnar styloid process is the distal part of the ulna. So if you find on your wrist, right at the wrist, the bony part on the radius on the outside, that's the radial styloid process. And on the inner part, which is not as distal as the radial styloid process, the bony part on the ulna is called the ulnar styloid process. We also have the interosseous crest, which we will have to just label, not palpate. And then the only other ones to palpate are the radial head and neck. So in regards to where that is, the radial head is about here. So if it goes a little distal to, actually I'll show on, this is probably a little easier. The radial head and neck here. So right at the joint line. So we go from the joint line is here, and we know that radial head, you just sink into the soft tissue, and that's where that radial head is. So let's try and feel for those on each other, and just pay attention to what you're supposed to palpate and what you're just supposed to label and locate. Vas-y.